Hi, everyone. Right here at the top, I just want to tell you how excited I am that my very own podcasting platform, Zencaster, is now a sponsor of the show. Check out the podcast download link in the show notes and stay tuned for why I love using Zen for Talk Nerdy. Hello, everybody, and welcome to Talk Nerdy. Today is Monday, January 31st, 2022. I'm the host of the show, Cara Santa Maria. And before we dive into this week's episode, I do want to thank those of you who make Talk Nerdy possible. Remember, as always, Talk Nerdyism will always be 100% free to download as long as I can keep making this show. I'm going to make sure you don't have to pay for it. But of course, the costs of making the show are offset by ad sales and by listeners just like you who want to throw a buck or two to each episode. And with it come quite a few perks, not least of which is an ad-free version of the show each week. So this week, I do want to thank the top patrons who pledge their support week after week. They include Daniel Lang, David J.E. Smith, Mary Neva, Brian Holden, Christopher Pitts, Dudas Infinitas, Gabrielle F. Jaramillo Gonzalez, June Sapara, Leonard Prince, and Ulrika Hagman. If you are interested in pledging your support and you want to see all of the cool perks that come along with it, all you've got to do is visit patreon.com/talknerdy, or you can just go to my website, talknerdy.com, and click through the links there. All right, let's talk about this week's show. It's a good one. Okay, this is kind of weird, but we really haven't talked about COVID much on the episode. And for the next 2 weeks, we're going to do just that. This week, I had the opportunity to sit down with Dr. Anthony Harris. He is a physician who's based in Chicago, also an expert on infectious diseases. He's actually the owner of HFit Health, and he's board certified in occupational and, I said that weird, occupational? He's board certified in occupational and environmental medicine. And don't worry, we're going to talk about exactly what that means. So we dive deep into all things COVID, the healthcare system, public health, social justice. It's a really important chat. So I hope you'll stick with us. Without any further ado, here he is, Dr. Anthony Harris. Well, Anthony, thank you so much for joining me today.
Thank you so much for having me. This is going to be a super pleasure. Been looking forward to it for some time.
Yay! Oh, I'm so excited to be talking to you, mostly because I think we don't do a lot of medicine, which means we don't do a whole lot of translational science on the show. We're not, I mean, sometimes we're lucky enough to talk about things that are like news you can use, things that, you know, people have access to today. But very often I'm talking about basic research on the show, or I'm talking to journalists about their coverage of concepts, stories, experiences. And that's the only time we really do, I think, dive into medicine. But it's rare that I have physicians on the show. So I'm excited to talk to you. You're an MD, MBA, MPH. So that's medical doctor with a master's of, is it business administration? That's what that stands for, right?
That's it. Uh-huh.
Yeah. Okay. And then a master's of public health. So you're looking at sort of the individual, but also the community when it comes to health and wellness.
You got it. You got it. It kind of speaks to the core of who I am with the degrees that I've earned, just because I've been, as the nature of this show, I've been a consummate nerd, right? Since birth. And my mom would always say, I grew up in the South. I'm a son of a preacher, Baptist preacher. And my mom would always say I beat to my own drum, right? And so she'd tell me, stories of, and I remember them. She said, go sweep the garage. And so instead of taking 20 minutes to go sweep the garage, I would spend 2 hours trying to invent a broom in a new way to expedite my sweeping of the garage. So that kind of encapsulates, my journey in medicine and business and entrepreneurism and doing intellectual property and patenting things. And it's been a fun ride so far.
I love that. So there really is that sort of like jack of all trades. Like I I feel like I feel you to a large extent that I'm not good at doing only one thing. I'm not good at sort of staying the course and having a very specific job and just, keeping my head down and doing the same thing day after day after day. Sounds to me like you're very similar. You kind of want to have knives in a lot of fires.
Absolutely. To me, that's where I'm having fun, right? The more I'm learning, the more I'm understanding different idea spaces, right? You read Tom Kelly and innovation, IDEO, their whole, how they form new ideas. It's not through, basically de novo synthesis of thought. It is mixing idea spaces together. And that's when, life really comes to even more, color, if you would, when you have the realization that as as the incandescent light bulb came to life, it wasn't de novo. It was mixing the idea spaces of how do you create coal, the process of creating coal, and a smoldering fire that led to Edison's discovery, right? And that's, to me, that's it. That's fun. That I could do for free. Fortunately, I found a way to make money doing it. So,
Yeah. Oh, I love that. I love that. And I think it's really the only way to be in our sort of modern world where there's so much talent, so much innovation, so many ideas everywhere you look that kind of transcend cultures and transcend neighborhoods and transcend backgrounds, that being able to connect to a lot of different people with their own unique experiences and sort of, I don't know, bring all of these different tentacles together. It seems like that's kind of the new way for many young people today. Kind of gone is the I work for the same corporation, from the time I was 19, and I just like
hmm.
incrementally stepped up and stepped up and stepped up. I just don't think those opportunities are very available anymore.
I agree with you, and I think we're seeing that play out in the marketplace right now. We know the job market is extremely hot, and employers are having to sell themselves ever more so, perhaps than before, to employees, potential employees. And you were seeing that in all sectors: financial, healthcare, industrial sectors. And it's just fascinating to see kind of macroscopically the evolution of society as we stand today, and how the impact of COVID has perhaps accelerated some of that evolution in a way towards just a different future. Not good or bad. It's just different, evolving, and so love to see how that will continue to unfold. Unfortunately, as we deal with COVID over the next 2-3 years.
Absolutely. I think that there's been a sort of hope or a clinging that many people have had. I've seen it because I work in healthcare as well. Right now, I'm doing my practicum training at a very large hospital here in LA in the cancer center. And I definitely notice that there's sort of an institutional, and not just here, I think across sort of medicine, there's sort of an institutional hope that like we will quote get back to normalcy, that like this big diversion into telehealth, like we can't quite bill it the same way and maybe we're not making as much money, and so hopefully we'll be back to brick and mortar soon. But I think we're seeing that it's providing access to medical services that never existed before, that people who are too sick to travel, people who are too unwell and struggle with transportation costs and childcare costs and all of those things can see their providers now from the safety and comfort of their own home. This has to become the new normal.
It does. I agree with you 100%, right? It has to be because not only are people gaining more access, they're being more productive. And, outside of the other repercussions of COVID, I think they're happier in a way in that it's allowed individuals to be more introspective about what makes them happy, right? And to sit and reflect in their day to day interactions. And now we have more freedom to choose those interactions, perhaps in this quasi remote accessed world that we live in now than ever before. And so it is fascinating to see how things will play out. We know 40% of the workforce will never go back to an in-office setting. That's the predictions in literature. We know that healthcare will forever be changed. We've accelerated, as you mentioned, telemedicine by 10 years at least, right? And it's interesting to see how the silos that were built to maintain the status quo of, let's just call it, twisted economics. That's me as I'm a Keynesian economist. And to me, anytime you disassociate the service from the payer, that's a twisted economic scenario, right? But that's our healthcare system. I think we'll get closer and closer back to what healthcare should be, like you said, by gaining additional access, but bringing the providers closer more easily to the patient experience.
I'm curious, your experience, right? Obviously, you have a very strong sort of business training and acumen, and you've kind of brought that into your work, but also this more kind of community health viewpoint. And you're a physician, right? You are trained as a physician, so you're board certified in occupational and environmental medicine. I'm not sure that myself and also most of the listeners know what in God's name that is. Like, what is occupational? I mean, that's
Yeah.
job, right? Occupational and
hmm hmm
environmental medicine. What does that mean?
Sure. So you are not alone. You guys are in good company. My own mama, right, didn't know what specialty I was going into. She's like, when I was already in residency, I was already fully a doctor, but she always said, when are you going to be a real doctor? What is this? What is this occupational therapy you're doing? And I'm like, Mom, it's not occupational therapy. I actually prescribe and I see patients. So the practice of occupational and environmental medicine, the board certification, falls under this umbrella of preventative health. And there's three disciplines under that umbrella in our board certification. Preventative health, there's kind of this offshoot of armed services, if you would, a flight surgeon type preventative health, and then our specialty, occupational and environmental medicine. And the specialty itself is about 100 years old at most. And that's before it became branded as such. And we're the docs that ended up becoming expertise in workplace exposures, right? And so if you are working in an environment that exposes you to asbestos, right, we're the docs that are tasked with keeping you safe and making sure your exposure doesn't kill you or, affect your family because you're bringing these contaminants home, which definitely was the case with asbestos. And so as we, progress through the evolution of our practice, we've gone from those, kind of how do we keep workers alive at the work site from the early days of our profession 50 100 years ago to now, how do we optimize the experience for the workforce when they're at work, right? How do we not just keep you in a state of asymptomatic experience, but more so, how do we improve your performance? Right? How do we enhance your mental well being so that if you are a developer for Amazon, we can help perform your best and in turn help the rest of society by what you're doing, right? So it's definitely a shift away from just the kind of run of the mill, what we call bread and butter occupational health, to this complete holistic approach to an individual and their experience with how they engage with work on a day-to-day basis.
Oh, very cool. I could see that there's likely some real crossover with the specialty in psychology of industrial organizational psychology. A big part of that is sort of going into the workplace and saying, how can people thrive? How can people find not just the job that they do, but their role within a community or within a hierarchy and contribute in a way that is meaningful to them and have good mental health at work, which is, as we know, work is like, what is it, like 75% of our life. Like in the West, work is everything. And I think that's, in some ways a problem, but I love to see that there are these efforts being made to say, sort of our culture is that we're going to spend a lot of time at work, and that work is going to become a part of our identity. It's going to become a part of our sense of self. And so how can we improve our relationship with work, and how can we be not just safe and healthy, but, potentially thrive in our occupation?
Yeah, absolutely, absolutely. And just to kind of and I'll do this in this venue because I feel like I have the freedom to do so, just because we are nerd friendly like myself, right? And so I think about the future of work in the auspices of Gene Roddenberry's vision of the future, right? If we look at Star Trek and we look at the professions that individuals have, no one's working for income, right? Everyone has all their essential needs met. The replicators make the food, you have companionship with your colleagues, and, they are out exploring the cosmos. And they're all doing their focused job because they enjoy it. They don't have to be, right? But they're doing it because it's what their passion is, right? And so, you know, I think as we hopefully progress through the evolution of our society in reality, it will mirror more so that vision that Gene Roddenberry had in regards to letting people do and live to work versus work to live, if that
Yes.
makes
Oh my
sense.
gosh. And so I've got to ask then, being a fellow Southerner, and I heard it in your voice earlier when you said umbrella, which is how I say the word too.
Nice, nice.
Yeah, because I grew up, born and raised, lived in Texas until I was in my mid 20s. So that's home to me. And where did you grow up, actually? You mentioned son of a preacher, but
Yeah, yeah. So I was born in Nashville, Tennessee. We moved to Florida when I was 3, and I grew up in Central Florida, a little bit in Jacksonville, 3 years, and then 45 minutes southeast of Orlando, a place called Melbourne, Florida, Palm Bay. We're about 20 minutes or so south of where the space shuttle used to lift off. And so we very much grew up. I was a space kid. I was in a NASA program from ninth grade until I graduated high school, and thought I was going to become an astronaut. Wanted to for a long time, but when I finally got my shot in med school, I was talking to a recruiter. Said, "Hey, I'm recruiting for some NASA, to become an astronaut. You know anybody interested?" And I was doing general surgery, going into general surgery. I passed on the opportunity actually because at that point I had fallen in love with business, and I had already gone down the route of getting my MBA, and I had already had a couple patents under my belt. And so, but it's just been fascinating to see how now space has come back to the forefront in the minds of people, from having grown up as a space aspiring astronaut, to where now more re-inspired by space exploration in a different way.
oh, for sure. There's a whole new sort of movement that's, I think, captured the imagination of young people. It all, sort of parallel with some Apollo era inspiration and excitement. I'm curious, you mentioned you grew up in the South. I grew up in the South. There is very often a curious and unique, and I think in many ways very culture bound, um, politic, ideology, viewpoint that is marinated in the South. And it, different for different people depending on, obviously, like I said, cultural backgrounds. But you were kind of hinting to something that I don't want to speak for you, right? So I want to know your viewpoint on this. But I am born and bred in Texas, but like literally the most progressive thinker, and am so all about the concepts of like universal healthcare, universal basic income, these ideas that I think personally would need to be the seeds of that Roddenberry-esque future of work. And so I'm curious what your take is, working within a medical system that I personally believe, and this is just my viewpoint, is very, very broken, and not just broken, like kind of immoral. I'm curious what your views are when it comes to sort of how we've capitalized medicine, and also, how you navigate with that.
Sure. So it's interesting, my viewpoint, right? And I struggle internally with the dichotomy of two things that I do hold to be true, right? I love the vision and believe it is the future of humanity to achieve the vision of Gene Roddenberry, in which, you know, for Dr. Crusher on Next Generation to treat you, she's not going to ask for your insurance, right? She's not going to ask, how are you paying for this visit? It's beam me to the sick bay and take care of me, right? Um, and you're right, I agree. To get there, we need more universality in terms of access. So I am very much a proponent of that. I am progressive. I was the kid arguing with my Baptist minister father that, both evolution and creationism can coexist, right? And when we look at then that philosophy and vision for the future and access, I do also subscribe to what Napoleon Hill writes about in regards to the self motivation, self achievement opportunities that help create and forge the nation to begin with, right? The U.S. to begin with, and the opportunity to help oneself and their neighbors and community, because I know we don't do this in isolation, but to be able to differentiate and see a vision and go for a future that it will take investment, but you have an opportunity to reap benefit from that investment, right? So, you have the juxtaposition of those two philosophies, or that vision of Gene, and then Napoleon's approach, that aren't, either one of them are not wrong, right? It's just, what's the bridge to get there?
Right, exactly. Given that we live in the system that we live in. I mean, the truth is out there. Like, the truth is out there. But like, you can open your eyes and say, this is the system that we have. So how do we get to this other place? You almost can't make just a huge left turn. You have to sort of iterate. And how do we do that? That's a tough, obviously, it's a big question I don't expect you to solve, but I bring it up partially because it's been on my mind lately, but partially because of some of the things that you mentioned. But I was messaging with a dear friend of mine who lives in Australia, and we were talking about COVID, and we were talking about access, and we were talking about our healthcare systems and, national health services, the differences sort of between the US and Australia, the US and the UK, and most industrialized nations that have some form of national health care. And he asked me like a very poignant question. I'm scrolling to see if I can find it. He said, there are shortcomings with universal health care, but the poor aren't left for dead. What did he say? He goes, what happens to people with psychosis who can't work? He just straight up asked that. Like, in your country, what happens with people who fundamentally struggle in a way that precludes them from exactly what we were talking about, this idea of like kind of being able to, I don't know, contribute to the workforce, being able to hold down a job, some people are too ill, some people are too they struggle too much, and our system doesn't really allow for that very well. In my answer, I couldn't come up with a good one. I was like, a lot of them are homeless.
Well, that's exactly it. I mean, not only, if the rosy way of looking at it is we don't handle it well. The practical, perhaps somewhat cynical way of looking at it is we criminalize them, right?
Yes, we
In a lot of
absolutely
ways,
do.
right. And I, having experienced acute psychotic care at Indiana University when I was in residency, we routinely would have our patients brought to us by law enforcement because they were picked up on the streets. And I remember this one young lady came to our ward as I cared for her as her primary physician in the acute care for psychosis, and she was from I believe she was like from Nebraska, right? Wasn't even from Indianapolis, but started her journey states away and ended up on the streets in Indianapolis because of the psychosis she was having, paranoid, in a paranoid state. And so it's like, how does one traverse that distance, right, without anybody intervening to help?
Right, and it happens all the time because 'cause they're forgotten, they're passed over, and like you said, we criminalize poverty in this country. Like our actual institutions are built that way. Like we when somebody quote commits a crime, whether, we can argue whether what they did was criminal or not, very often the quote punishment within our judicial system is monetary. I mean, by definition, that's criminalizing poverty.
That's it. That's it. And it's not slowing down. Let's put it that way. Unfortunately, and I think we are. More and more people are waking up to the presence of these type of infrastructural biases. Right. I think COVID has highlighted that. Right. If we look at some COVID statistics, if you make more than $80,000, you are 90% or more likely to be vaccinated. So what does that mean, right? What does that tell us about the income gap, right? Or about access, or about philosophical approach to messaging to people around what's prudent to do for your own health and wellness, right? We shouldn't have an economic gap on philosophical approach to healthcare in terms of what's best for human existence. It shouldn't be that way, but it is. And so one has to ask the question, is there strategic messaging in place that is designed to disadvantage, from an socioeconomic standpoint, a population of people?
You're so right. I mean, I think it's a hard thing for people who really value education and especially the scientific message, I think, or the scientific method to really sit with are the comparisons between the historical and present rule by sort of the wealthy white male elite class. And we can look to colonialism, we can look to all of these examples, and it's very clear on its face the damage that has done to people who have been oppressed by those groups. But it's sort of hard then to see the parallel between the educated elite class today, the lawmakers or the public health officials, and see that there's a big income gap there too. So when speaking to the greater public, you can't speak the language of the educated elite always. You can't like what's best for you in your own mind, it doesn't always translate. You still need a plurality of voices in the room. And I think we're missing that because very often people who kind of came up through academia are like, yeah, but I'm right. They're like, but this is reality and this is objective and I'm right and this is what's best for people. And it's like, this is still kind of a colonial perspective. And I think we have to be really careful and introspect a lot and recognize that about ourselves.
I agree 100%. I mentioned Napoleon Hill earlier, but he speaks to one of the keys to success, right? If you read his materials, and one of them is open-mindedness, right? And we find very easily that, if you are not open-minded to literally all concepts, all walks of life, the ability to learn, or the mentality that you can learn from anybody in any position, right? Um, that's what we're missing in today's society, right? And it speaks to a closed mindedness that has produced these huge gaps in philosophical approaches. And I know this is a different topic for a different day, but we know that social media can, focus individuals down one direction, and blind them to opportunities to think differently. But it's things that we hopefully recognize more and more. We're going in the wrong direction, I think, unfortunately, but we have to reverse things if we are going to get to the point where we're able to achieve Roddenberry's vision, right? Because imagine, this is my personal belief, there are, intelligent beings aside from ourselves in the universe, right? But just imagine the first encounter experience of our current closed-minded society with a
Oh,
new
it's like,
species.
yeah, it's Arrival. It's every movie we've ever seen where it's like a hostile military experience.
Exactly, exactly.
Yeah.
And what tremendous opportunities we will miss to advance our own society if we ever should have the opportunity for that first contact experience, right? So I mean, it's just, I don't know. I mean, at times as a physician, right? Um, there's been times where I literally had to dig deep to stay positive on the approach we've had as a society towards healthcare, right? Of are we heading in the right direction or the wrong direction? As e- someone who studies economy, I got my MBA in the whole nine. Again, had to dig deep about how we as a society approach economic prosperity for the masses, right? And then if we look at the public health factor, COVID has now made it very hard to see how we're going to exist on the other side of this pandemic together and not divided, right? And it's just, I don't know, it's stressful at times. I'm not going to lie.
For sure. And I think, obviously that's sort of the million-dollar question here. And that's something that I was so excited to have you on the show to talk about was not just our current healthcare system, but how it's sort of been, how COVID has shown a light on a lot of the things that are working and the things that really aren't working. And really, I would love to talk to you, about busting myths around what we should be doing about COVID, misinformation around the virus. Like this is a huge, huge topic. But I think sort of the first big thing to grapple with is the idea that people have become somewhat entrenched. How do we, I don't know, tell me what you think about this. I remember reading, this was months ago now, but some of the literature sort of coming out of like the science of science communication and sort of the psychology of patient values and things like that, that sort of more entrenched people, whether they were vaccine hesitant or whether they, had anti-vax rhetoric. So depending, it sort of didn't seem to matter where their reasoning came from, but people who were refusing or quite resistant to get vaccinated or do a lot of preventive health things around the virus, wear masks, social distance, all that. The number one influencing factor for them to change their minds was their doctor. Like if people were going to switch and say, maybe I should get the vaccine. Maybe I should. It wasn't because social media told them to. It wasn't because a neighbor told them to. It wasn't because their family told them to. They were in their echo chambers and they were going to believe what they were going to believe. But when their trusted family physician said to them, Joe, whatever you believe, truth is, why not just hedge your bets? Come on, man, get the shot. It's important. They would do it. And so there's still, regardless of this like massive, what I see is like sort of this scary distrust in authority and distrust in sort of our physicians and our public health officials. I think at the personal individual level, people still do trust their doctors.
Yeah, I would agree with you, and I think it's the notion that when you're affected, when your health is on the line, right? Who are you going to turn to, right? Where do you go for that help, right? And the fact that individuals still one trust the system enough, to come to a physician, right, or the nurse practitioner or the clinician, is telling. And I hadn't heard that statistic before, right? That study. I definitely got to go out and find it and read it. But it is comforting to me as a physician, to know that the influence is perhaps because it's the messaging and the relationship, right? The trusted relationship, and then the messaging that and the recognition that as a physician, I honestly don't have anything to gain or lose personally in your health, right? And my patient's health. But it is the level to which I take one pride, and it's an honor to be able to assist someone in their own health journey, right? That I hold dearly, right? And that is, and I think, no matter your take on physicians and being cynical towards them or not, for the most part, I think physicians hold that very dear to them. That the privilege to be able to intervene on the behalf of someone and recommend what the right move should be for the health and well-being of that individual, right? And I definitely value the opinions of physicians that are on the other side of this than I am in terms of should you get vaccinated, should you not. I still work with them at at the group that I'm a part of now, and it's good though to have the different frame of approach, right? Of each, because to me, it's only when we have all ideas on the table that we know we're going to arrive at the best solution for all of us to move forward with, right? Um, it's only when we're talking misinformation that we have all potential harm and no benefit. Whereas contrasting opinions, you still get benefit from a collective understanding of what we see in the clinical literature, what we see playing out from an epidemiologic standpoint, and anecdotally what we experience as physicians. That's what comes to the forefront when you have that healthy exchange versus misinformation in the mix.
Yeah, and being able to know the difference between those things is so important. I think before we even dive into that, because I do want to get into the misinformation, I'm heavily reminded of like a physician on Twitter who I follow tweeted, it was a while back now, but something very kind of poignant about how, and it felt cynical, but at the same time, I was trying to empathize with her position that like she was exhausted and she was frustrated, and she's like on the front lines all the time, seeing all these people who didn't do anything preventive come in so sick, desperate for treatment, and she was getting frustrated, and you could hear it in her words. It was something along the lines of, it's funny how they don't want to listen to me when it comes to preventing getting sick. But the minute that they're sick, they'll do everything I recommend. They're desperate for my help. And it's easy to sort of see that and hear that and go and get cynical and be like, yeah, F them, blah, blah, blah. I'm so angry. But I think there's another side to that, which is so important, especially for those of us who are maybe in that position of pro vaccination, who are in that position of pro public health. Like, yes, I'm looking at the literature. I want to make evidence based medical decisions. And it's very easy to get very high and mighty. And I think it's important to stop and go, okay, so what is going on there with these patients? And what can we learn from this? Clearly, we're not getting to them in the prevention communication, but we are getting to them in the desperate, this is my last chance communication. Where's the disconnect? How can we take this information and do better, as opposed to F them, they're a lost cause. Let's, shrug them off.
Right, right. No, that's fascinating in terms of, how do we use this, right, to learn how to not just intervene, but to engage. It's all about engagement, right? And if we engage around, okay, so I told you I'm under the umbrella of preventative health. Much of what we do is not treatment, it's preventative, right? I do your physical if you're new to a job to make sure that the job is not going to cause you to have a rotator cuff tear on day 3 of the job, right? And if you have an impact from a respiratory illness, I want to make sure you're around, these chemicals that can have a detriment to somebody with pre-existing conditions from a respiratory standpoint to not cause harm to you, right? So it's all preventative. And outside of regulatory, this is kind of the microcosm of getting back to the macro level, right? It wasn't until we had legislation in place that compelled companies to put in safety measures via OSHA, that we had the level of safety protocols and preventative implementations to protect workers. So it was the question of like, how do we engage and get people to do quote unquote the right thing, not just for others, but for themselves. If we're looking at the economic perspective from an operational standpoint, companies didn't by far and large do that till 1990, and OSHA had to promulgate legislation to force them to do so, right? And so if we dial that back to the individual, obviously the latest attempt at doing the right thing at the individual level from the regulatory standpoint or legislative standpoint was the federal mandate for large employers, right? And we saw that was considered an overreach by the Supreme Court of authority from an OSHA standpoint. But it still begs the question, can we get people engaged enough in what prevention looks like for themselves to the extent that they do something about it, right? And that's ever more the challenge in preventative healthcare, because one, no one wants to pay for prevention, right? You're paying for something. You're paying for the avoidance of something that may never happen.
It's true. And so it's hard for people to see the ROI, even though it is there, it's just not immediate. And you have to calculate it as like a larger thing with externalized costs added in. And people don't like that. They want immediate one-to-one ROIs.
Exactly. And so now if we translate money ROI into time, a temporal ROI, right? People don't understand or see the value add of investing their time to do and participate in healthy behavior because they don't connect it with the ROI benefit of longevity and prevention of health. And so that's where we got to get at. We have to strengthen the association of we always say an ounce of prevention is worth a pound of cure, right? But at the end of the day, how do we sell that to individuals, right? How do we get that to the level where the majority of people are participating in preventative actions that are going to benefit themselves and vice versa, benefit their community because now they're able to contribute at levels beyond what they could have in a unhealthy state, perhaps, right? And again, going back to Gene Roddenberry, right? I don't know if this was intentional or not, but if you look at the casting of characters in that series, right? How often did you see ill individuals? If you look at the population casted in, Star Trek: The Next Generation, it does not mirror the morphologic picture of the U.S. So was there a breakthrough in terms of, healthy behavior modification and the ROI that people recognize, right? I think there was, because the moment you take out the need to work to live, right? Perhaps we then can focus more on the quality of living.
Oh, absolutely. I mean, if you were probably, I'm guessing, and these data are probably out there, but if you were to do just kind of an open-ended survey of, X number of Americans, random survey, how much do you exercise? How much do you focus on eating healthy, blah, blah, blah. And then they were to tell you, and then you were to say, what is the number one thing preventing you from doing that? They would probably all say, I'm too damn busy. I don't have enough time. I'm exhausted at the end of the day. It's hard for me to exercise because I have to put all my effort and energy into my job and rearing my children and, all the different responsibilities that I have. Like it's a luxury to be able to do self-care.
And they're not wrong, right? If we break it down to the psychology of the human, disposition, we know that it takes willpower to execute on a regimen of healthy behavior, to exercise, to not eat foods that may have a detrimental effect over time on our bodies, right? And we know that that willpower is consumed through focused activities that may not be again, focused on our own health and well-being, i.e. our jobs, right? If we're making widgets on the front line, that does take will to make sure that you're not making any errors and that, you're having to deal with the complexities of your day in a work environment. And so at the end of the day, literally your will is spent.
You're so right. Yeah, you're like your frontal lobe is done.
That's it. That is it. And so we have created, in the aspiration of becoming a hardworking nation, a nation of low willpower at the end of the day, because we spend it towards activities that are not geared towards creating that healthy environment for the individual.
And of course, my view is that, a lot of this is tied up with our kind of obsessive, relentless, almost religious worship of capitalism. Like this is personally how I feel. And because the truth is, everything is all about more efficiency, more like each each quarter, a company is expected to earn more and more and more. And like it is a zero sum game. Like at a certain point, there's no more to earn. And just like with us, we're constantly like, how do I give more? How do I do more? How do I do better? It's relentless. And how does that sort of promote balance? How does that promote well-being, self-care, which we know a lot of well-being and self-care is about taking a step back, taking time, breathing, doing things for ourselves that are in some ways in direct contradiction to working harder, better, faster, stronger, earning more. Those things are in conflict with one another.
Yeah. Well, that's a great point. And, it talks about our focus. Where is our focus? Is it external, right? In terms of what does productivity look like? Or is it internal? Like, can we develop a stronger internal locus of control to understand that, how can I become better? Right. Or I become focused in, if we shift away from how can I do better in terms of, productivity externally? How can I make myself better through, all these things you spoke to, the mindfulness, the, healthy behaviors? Perhaps if we can start to shift people more centric in that thought, then we will see, an opportunity for us to climb out from whence we came or are coming, which is, this, it's all focused on external productivity, right? Our metrics are wrong, right? What gets measured gets done. And rarely do we take time to introspect and measure, how am I? How am I performing as an individual? Am I at my peak, my best of what I can be? You know, um, yeah, I was just thinking about that from that kind of uh, what is it called? Witnessed observer mentality, if you would.
Mm-hmm. Yeah, kind of like stepping back, turning in on yourself and really seeing that. Very often in therapy, one of the things that I recommend to the patients that I work with is that metaphor of being on the airplane and there's low oxygen and the masks fall down. And what do they always say to you in the safety video at the beginning? Every time, put yours on before you help anybody else. Yet when we watch a movie where there's a disaster and a trauma, who are the heroes? They're the people who forego putting on their mask so they can rush out and try to help everybody out. But then they die. They burn out. They're not taking care of themselves first, which means that, yeah, okay, they've saved three others, but in the process, they've eaten up all of their oxygen. And we never highlight the people who put on their mask first and then save their families, or put on their mask first and help everybody in their row. And those are the people for whom they can have both. They survived and they did what they could do for their neighbors or for their job or for their family, whatever, however you want to extend the metaphor. But we're just not trained to think that way. And that's a problem. Yeah.
Yeah, we've kind of twisted selflessness to its extreme and neglect the self in that
Right.
process.
Yeah. Like
And,
heroism means that we can't do anything for ourselves, which is not true.
yeah, it's not true. Exactly. Yeah. Yeah. It's it definitely, it is interesting to see how culturally we have arrived there, right? Um, particularly when you still have a very much contrasted culture across the pond, right? I still get kind of a tickle every time, and maybe a little envious, right? When I work with and consult with companies that take the entire month of August off in Europe, and it's like, wow, I wish I could take. I mean, usually the first thing
Yeah.
out of my and other people's mouth was, I wish I could or we could take the entire month off. But in practice, there's no reason why we couldn't, right? It's just a matter of our culture is not that.
Yeah, yeah, and we haven't made space for it. So, it
Exactly.
was like the left turn we were talking about. You can't do it overnight because we've built up an entire structure that is an obsessive, a structure that's obsessed with productivity.
That's it. That's it. Yeah. And at the end of the day, are we more productive? That's the
Exactly.
metric
Or are
that
we just
I
more
don't.
burnt out and bitter?
Correct.
Yeah.
Correct.
Yeah.
Because, being busy is not the same as productivity, right? Um, and I think sometimes or oftentimes we let that metric kind of fall through the cracks.
You're so right. Like, there's that big study that came out of, I think it was, like, Denmark or Sweden recently, where there was a big government kind of funded thing to drop the work week down to 34 hours, and then they looked at all these different metrics across the board, and they were like, "Weirdly, people are still getting just as much, if not more done, and they're working fewer hours. Hmm." Yeah.
I mean, we know the psychology of productivity. Like the average person has 4 hours of productivity in their day. Four. We have an 8 hour day by standard, and oftentimes that's a 10 or 12 hour day, right? Um, so it really begs the question. One of the books I read recently called The Productivity Project, right? Where this, I think it was like 18-year-old did a series of experiments on himself to see if he can maximize his productivity. Taking using caffeine religiously, staying up longer hours, burning the night the candle at both ends, or sleeping more. And so you walk through his story of an experience of these experiments on himself. And at the end of the day, the recommendation of the book is take care of self first, and that
Yes.
will maximize your productivity in whatever you're doing.
Yes,
So
yes.
it's a message we have to circle back to over and over.
Absolutely. And I think one thing that's really important for us to spend some time in, given that we're still in a very um uh difficult part of the COVID story. You touched on it a few minutes ago, so I want to circle back to it. You were touching on sort of the American way and American culture and sort of the differences between, what's going on here versus across the pond. And of course, there's also, we can talk about Western culture versus Eastern culture, but even within America, and this may be uh, curious to people who are listening to show from outside of America, but probably a lot of people who live here are going to be vigorously nodding. We have so many different subcultures within America, right? There's Southern culture versus Midwestern culture versus coastal culture. There's left versus right. There's different ethnic cultures, different racial cultures, but collectively, often when we talk about the milieu that makes up American culture, it's kind of got like a white male lens to it. Like, let's be honest, that's sort of when we talk about America as a whole, we're talking about who historically had the power. And the truth of the matter is, when it comes back to misinformation around COVID-19, I think we have a tendency to paint with a very broad brush. There's the people that are in the know and the people that are evidence-based and the people that are, getting vaccinated and getting boosted and doing everything right. And then there's those people who just are denialists. But it's not that simple, is it?
It's not, right. I think it's unfortunate the way we've allowed, and I'm not trying to harp on media, right? But there's a concept there's a concept, I think Napoleon Hill was the first to talk about it in this context, being accurate thinkers as a goal in life, right? And to speak to things that are factual, right? When you're speaking to anything, and even a layer deeper than that, if you're talking about your own productivity, to speak to those facts that are concerning your goals and that you're trying to achieve, right? And I think we've, as exemplified in the statistics that have shown us, the things that trend the fastest are not the facts, but the misinformation, right? Um, and that is what's alarming, that we have created this environment in which consumption has trumped everything, right? The quality, and this not only pertains to our knowledge, right? And what we perceive to be fact or not fact, this is quality of our food, right? Consumption trumps everything. And this is consumption of our time, right? It's not about quality of how you spend your time in terms of, are you productive based upon your own metrics, it's, gotten to the point where, it's what consumes the most of your time perhaps is not the most productive use of that time.
We want the most saturated, the most calorically dense, the strongest flavor, the most, let's say, distracting. And we don't, we're a culture not of less is more. We're like, well, no, more is more. Like, give me it all because, yeah, and it's hard for people to like detox from that. It's hard for them to take a step back and feel. It's one of those weird things. It's like drug cessation in a way. The part where you quit hurts, but once you're on the other side of it, you're like, "Holy, this is what it feels like to be healthy again."
Yes. Yeah. I mean, we are on a constant dopaminergic kick,
Yes.
and from, it literally starts from childhood, right? I mean, I watch my 16-month-old son engage with, my cell phone and the joy he gets from swiping at 16 months, right? I'm like, holy crap, I got to get this out of his hands because I mean, there's clearly evidence that it's bad for him to begin with, right? At that age, particularly. But just to see it play out so clearly that our consumption and, like you said, it's, almost, well, I guess at the end of the day, to me, the saddest or the most alarming part is it's been normalized that this is what everyone is doing. So the oddball is the person who's not consuming, right? At the levels of everyone else. And so it's the race to the top of Maslow's hierarchy of needs. And at the end of the day, um, I don't know where that leaves. Well, I have my druthers about where that leaves us. But if you look at the evolution of societies over time, but unique to the U.S. and our current position, where is that going to leave my kids, my 4-year-old and my 16-month-old, a decade or 2 decades from now, right? If we're already at that level now, that's what gets me, you know, definitely worried.
And it almost like what I think of as a perfect sort of metaphor for this is the US. When we look at hunger, like poverty and hunger in the US, these basic core human needs that are just heartbreaking. And we compare what does hunger in the US look like compared to hunger in certain countries in sub-Saharan Africa. And we look at the actual physique of an individual who is hungry. In the US, hunger is linked to obesity because we're eating things that are calorically dense but have no nutritional value. And whereas in many other parts of the world, hunger is linked to starvation. It's linked to an anorexic view of the body. And I think that's a perfect example. It's like we're starving ourselves with too much. It applies to everything. It applies to our consumption of media, of food, of toxic, positivity, of productivity, all of those things.
That's it. That's it. So shifting, our existence from volume to quality, right? That is the movement we need, right? At all levels. That's what I mean. Because again, you look at. I know I keep going back. I'm a true nerd. I keep going back to Star Trek.
Yeah, hell yeah.
but but if you look at the quality, right, of the things presented in that vision, um, they the characters, not only were expertise in their own individual roles and field that they were there on the enterprise to execute on, but they also had these other passions, right? Playing the trombone or the violin, data, and or studying history or anthropology, which was Picard's fascination, right? So it's or archaeology, excuse me, I said anthropology, which he kind of did that too. But it's like, okay, let's get back to quality of consumption. Because to me, at the end of the day, that's what's going to move us as a society towards that ultimate vision where there won't be any need to work for, sustenance. it'll be provided because we would have created that opportunity in our endeavors.
Oh, I so agree. I'm going to be that jerk who, like, you know how when you watch a movie or a TV show where you're like, what a perfect ending. And then they're like, nope, we're going to add more. I'm doing that right now. Like, that was such a
Love it.
button. I could have been like,
Love it.
thank you, here, goodbye. But, as we round out the hour, there's still a pressing question or two that are in me. So I'm like, let's keep going.
Sure. Let's
I'm
do
going to
it.
steal you for a couple more minutes because I
Yeah,
want to
yeah.
kind of circle back to COVID and how, these, these insights play out with regards to how a normal person from, let's say East LA to somebody who's living in Chicago to somebody who's living in rural Iowa to somebody who's living, across the globe. How are they to grapple with all of the rhetoric that they're seeing? How are they to know the difference between truth and fiction, between valuable information and misinformation? Because again, it's easy to say, oh, they're in an echo chamber. Oh, they're all just like Fox News consuming, like anti-vax, QAnon conspiracy theorists. That's the heart of who's not getting vaccinated. But that's simply not true. There are a lot of people who aren't getting vaccinated because of distrust within their communities, who aren't getting vaccinated because they don't have access or they don't understand the process or the protocol. Or, there's so many different reasons. So how do we contend with this as a nation?
Agreed, agreed. And the way forward, and this is not self-serving in any way, but I think is to rely. We're dealing with a healthcare issue, right? And so my go-to in this regard is leverage your healthcare workers, right? Leverage your physicians, your clinicians that are in your communities, that are experiencing locally the same as what you're experiencing, right?
Right, because they come from
And
where you come from and they speak the
that's
same
it.
language and they, eat at the same restaurants and went to the same schools.
Exactly. Exactly. And those in the same way you spoke to the statistics earlier about, what was impactful at changing the minds of those who were on the fence about getting the vaccine, do similarly a seeking of information on things related to COVID. And your clinicians will tell you, yeah, there's data that shows COVID can cause erectile dysfunction, can cause global inflammation of the brain, and in various areas that we have yet to fully understand the long-term implications of, right? And really leverage the expertise that we have in those clinicians, because one, it's their job and hopefully their passion, to share this information, but to do so accurately, right? And
Absolutely.
yeah,
Oh,
I think if we look there, we'll find uh, an opportunity for us to kind of rest easier, right, as a general population, because then we can tune out some of the rhetoric that we hear that we either are distrustful of on one side or the other.
but I think healthcare providers also, it's imperative that they be aware of what that rhetoric is so that they can speak to it. I think to know, that Rogan and Malone are saying, your risk of myocarditis is insane from the vaccine, don't get vaccinated. It's important for a healthcare provider to know that that's what's being said so they can then come back and say, well, let's talk about your risk of myocarditis from COVID. Let's actually compare these things apples to apples. I've been reading the literature and this is what I'm seeing. And it's important, to not just kind of paint every patient with a broad brush, but to say, what are your concerns? What speaks to you personally? Let's see if we can grapple with that together.
That's it. That's it. It's personal, right? The decision to get vaccinated or not is personal. The decision to protect your friends and family or not with a vaccine protocol, that's personal. To show up to work, right? And wear masks. That's personal. And getting at that level of personal relationship with your clinicians should be the go-to for if you have access. Now, granted, we still got to struggle with those who don't have access in their communities,
Right, and I was
right?
gonna say, like, I
Um,
literally just picked up my phone to check the time, and I had a pop, the notifications that you pop up on the front of your iPhone. BuzzFeed News, a CDC report found that people of color are less likely to get life-saving COVID-19 treatments like monoclonal antibodies. And of course, we know
so
this. This
true.
doesn't surprise me at
Yes.
all, but it's
Right.
it's
Right.
just reinforcing the problem that we're talking about, even if everything is, even if somebody wants it, even if they're trying, by virtue of the color of their skin, by virtue of the neighborhood they grew up in, by virtue of, generations of history of systemic oppression in this country, I'm not going to get they're not going to get the treatment that they need. Like, what?
That's so
It's
true. It's so
infuriating.
true. Yeah, yeah. I mean, access to it, right? Availability, and oftentimes, sometimes it's a cash pay, right? It's not covered by insurance in previous times. So, there's definitely that divide. I mean, even who's vulnerable at as we looked at the pandemic. We know Black and Brown communities were adversely affected, but some of the factors that we didn't speak to up front were things like carpooling, right? Black and brown workers are more likely to carpool than their white counterpart.
Or use public transportation.
Exactly, exactly. And so
Yeah.
even if you had protections at work to help prevent COVID spread at work, right? The moment you left that job and got in the car or the carpool with your colleagues, guess what? Your risk went back up, right? And so it was the socioeconomic impact of your circumstance that led to the increased risk. So even access to childcare became important as a factor as to whether or not individuals contracted COVID or not, taking care of their sick children or the ability to come to work. I mean, it was complex in terms of the factors that have been examined and have been shown to play a role.
Yeah, we could grab a whiteboard right now and brainstorm 9,000 different reasons that, but
Yes.
these are mediating and moderating variables, because the truth of the matter is that Black and brown people in America simply don't have as much available to them. They're simply living in more crowded quarters. They don't have the opportunities to take a sick day from work. They don't have, and that's really what it's about. All of these different factors come back to the fact that our nation was built on privilege for a specific class. And we continue to not just struggle with that, but it continues to be reinforced. And that's the real gross thing. There are literally people across our country who refuse to admit that that's even the case. And now we're seeing legislation across the South that's being presented, and even in some cases passed, to protect the emotions of white students so that they don't have to think about things that make them uncomfortable.
Yeah.
Like, this is,
It's
ugh, I know.
it's remarkable, right? And to your point, right? The fact that we still have some that refuse to, even acknowledge that these biases exist is troubling, right? We sure as heck didn't see that play out in Roddenberry's future.
That's true.
Right, and perhaps and I'm being a little jocular here, but you know, the people always kind of ponder, when will we see the day that these race biases cease to exist, right? And I said, well, we know how we can speed that up. Just look at Independence Day, right? We get attacked by aliens, and everybody, is fighting for existence of the planet. We'll see, our all of our bias turn towards that invading race, right? And outside of that, where's the bridge, right? How do we recognize that we are the same people, that we come from the same dirt, we breathe the same air, right? And as we do, as our neighbor does well, we will do well. That is the communal, philosophy that I think we're hearing less and less of, unfortunately, from both sides, because it's one of protecting the ideals of of each side without that open mindedness to share of what the blended future looks like together.
Here, here. So, as we're sort of winding down the hour, Anthony, I always ask my guests the same two questions. And I'm always really curious, based on, their area of expertise, where they're coming from, how they're going to answer those two questions. So I was hoping I could now pose to you the two really big picture questions that always close out Talk Nerdy. You ready for them?
I'm ready. Hit
All
me.
right. So when you think about the future in whatever context is relevant to you right now in this moment. So this could be, occupationally, it could be global health, it could be, this very Roddenberry future that we've been discussing. It could even be cosmic. Whatever context makes sense to you. Number one, what is the thing that's been keeping you up the most at night? The thing that you're really pondering and worried about? Maybe sometimes you're finding yourself being pessimistic or even cynical about, the thing you're like you have legitimate concerns about. And then to end on a more positive note, on the flip side of that, where are you finding genuine optimism? Where are you, authentically really finding hope, and what are you looking forward to?
Hmm. The thing that keeps me up at night is disregard for human life. I'm seeing more and more examples, particularly here in Chicago, um, of disregard for human life from its core of, our how often we see homicides, and from its, not as in your face disregard of how people are treated, right, and dehumanized. I think that we're moving in the wrong direction there. And that keeps me up at night from a societal standpoint, but from a personal stance, it keeps me up, imagining what future my kids are going to have, right? They can't go down street, to the park and play. I live in Chicago proper, and that's not a reality for them. It's not safe, right? And so it's not getting better. It's getting worse. And that is, troubling. And we see that a little bit on the macro level as well. What the positive thoughts I have around us as a society is this resurgence of aspirational togetherness, right? Exploration, like we talk about, SpaceX and all the thoughts that we are going to further our reach into the cosmos. Um, to me, that engenders, by nature of that lofty aspiration, a togetherness, recognizing we can't individually make it there. Not just as a nation, but it's going to take a global effort to reach a aspiration of space exploration, to reach the aspiration of zero carbon emission globally, and that to me, at the same time, I see this escalation of disregard for human life. I also see a swell of the populace focused in on, what the future, creating that vision of the future in a day-to-day achievement fashion. And for me, that I, definitely I'm an optimist. The glass is always half full in my life. And to me, that we have the opportunity to encapsulate that optimism with what we're accomplishing now and what we're seeking to accomplish in the next 20 years.
Ugh, here, here. Well, gosh, Anthony, thank you so much for spending the time with us today. Before we say goodbye, I'm wondering, for the people who are listening, where can they learn more about the work that you do? Maybe social media or websites, or how can they sort of become more exposed to the incredible work that you're doing?
Sure. So you can check me out on Twitter, Dr. Anthony Harris, at Dr. Anthony Harris. You can check me out also with the work we're doing at HFit, which is our branded services from wearable technology for ergonomics to preventative health at hfithealth.com. Would love to hear from you and love to collaborate. Or if we sit and just ponder, the theories of astrophysics, I'd love that too. So
Yes.
this has been
Oh,
awesome. So happy you've had me on the show here.
it's been such a joy, such a pleasure. Thank you so much for being here. And everybody listening, thank you for coming back week after week. I'm really looking forward to the next time we all get together to talk nerdy.